It's an honor to be here today. Priya Kapalbhati, Interventional Cardiology. And today it is a distinct honor to have our guests back again for a fourth episode of the Breathonance Series. I'm especially excited because this is Women's Health Week, and one of the topics that I constantly talk about with my patients, especially the women that come to my office who have conditions like spontaneous coronary artery dissection, cardiomyopathy, these people are selfless in giving and giving so much of themselves to others, but really have not found a way to optimize their own life. And so I think the topic of sleep is very timely. I, as an interventional cardiologist, also struggle with sleep. I also feel like a hypocrite when I tell my patients, like, hey, you got to sleep better. It's important for your health. And so I'm really excited to learn today from Dr. Amit Anand, pulmonologist, sleep medicine expert, co-founder of Breathonance. I don't know what he hasn't done yet, who has synergistically built this Breathonance platform with Clint Valladares, who's a global musical guru who wears very many hats and has offered his expertise into the healing space. And so excited to have you guys here today. What are we talking about?
Thanks, Priya. It's great to be here again with you and with Clint. And I have to acknowledge, yes, women are so important in our lives. This is Women's Health Week. I wanted to bring awareness to that. As the caregivers in our lives, as the nurturers in our lives, they're always giving, nurturing, caring for. And sometimes, to the extent that they don't look after themselves all that well. And sleep is a big part of recuperation, recovery, rest, so that you can charge up at night to give again in the daytime. So I'm a pulmonologist. I'm a critical care doc. I'm a sleep doc. Breathing sort of links all aspects of my clinical work. But sleep, I've figured out, is the most important aspect of what I do in the clinical realm. If we don't sleep well, we don't think well. If we don't sleep well, we don't eat well. If we don't sleep well, we don't breathe well. If we don't sleep well, we don't exercise well. Nothing works. It's literally the platform upon which all the pillars of waking health stand. And so I'm excited to, speak a little more about that and perhaps give you and the audience a tool today in terms of improving breathing while sleeping, to help both quality and continuity at night.
And I also want to acknowledge that you guys have done amazing work in normalizing the importance of sleep. It's something that we do every day. We spend a significant percentage of our lifetime sleeping. And so why not give that more attention that it deserves? And we know that it affects our entire body, our nervous system, our endothelial function, all of the different processes that happen physiologically in our chemistry. And I think it's magical that you're able to pair that with music to synergistically build more of a healing effect. And so I'm really excited to get right into it.
Yeah, no, let's get into it. It's interesting that most of us are not even aware of our breathing. From our first breath, our first cry to our last gasp, if you're lucky to live to 80, and you're breathing at about 16 breaths per minute, which is about 960 in an hour, or about 20,040 in a day, that translates into 672,768,000 breaths in a lifespan if you live to 80, of which one third is going to be while you're sleeping, which is about 222,014,440 breaths at night. And yet, how aware are we of our breathing? Not a whole lot when we're sleeping, and certainly not a whole lot even in the waking state. Turns out that our breathing health at night can serve as a glue to sleep quality and sleep continuity. A lot of us, as we age, there are many competing influences for both quality and continuity. We tend to become mouth breathers at night if we snore or we gasp on our breath. So restoring nasal patency, becoming a better nose breather at night. And there's a lot of talk now on mouth taping at night for snoring and sleep apnea. But there are practices that one can do in terms of techniques to enliven the patency of the nasal airway, clean out the sinuses, that actually help enhance sleep quality. So I'm going to be talking a little bit about one of those techniques today. It's called the breath of fire, or Kapalbhati breathing in pranayam. It's a very powerful practice. It's a little different from what we did in the last 3 sessions, which were slow, large volume, resonant frequency rhythms. This is going to be about accelerating the breath and using the abdominal nostril corridor of breath to clean the nose, to clean the sinuses, almost like a neti pot, which people use with saline. But this is just a breathwork practice set to music by Clint. So let's get into it. The normal act of breathing is an active inhale and a passive exhale. So the effort is on the in-breath. The balloon deflates on the out-breath. In the breath of fire, we flip the stroke of activity to the exhale. So the exhale becomes vigorous, it's brief, it's small in volume, and the inhale is passive. The exhale also becomes very short in duration. The inhale, relatively speaking, is about 3 times as long as the exhale. So how do we do this? This practice works the abdominal pump, the belly muscles. The chest is going to be completely quiet with this practice. And when we start to bring the attention to the belly pump, when we forcibly bring that belly in, the diaphragm is pushed up, the lung volumes become smaller, the air within the lungs is expelled through the nose. And this is not intuitive. In fact, it's very tough to master this technique. And by the way, anyone can do this, except if you have issues with accelerated hypertension or an unstable heart rhythm. That's the only time I would say don't do this. So you are now learning to engage the belly muscles, bringing them in actively with the exhale. The diaphragm pushes that air out through the nose. How do we develop this muscle connection between the belly and the nose? Imagine there's a candle flickering at about 5 feet in front of you. There's a flame right over there. And I tell you, I want you to extinguish that candle with your breath, with your mouth. The way you would normally do it is, since it's at a distance, you would forcibly exhale. You'd create that puff. You bring that volume of air all the way in a straight line to extinguish that flame. It's not going to be, you're not whistling your air out. It's going to be a quick, brief. If you had to blow out that candle and you simultaneously put your hand on your belly, you would note that the belly actually moves in when you blow the air out. So why don't we all do this together? Whoever's watching today, put one hand at the belly, imagine that flickering flame at about 5 feet, and we're going to do this about 10 times. Do you feel that connection develop between the belly moving in and the breath moving out through the mouth? But Kapalbhati is done through the nose. So rather than breathing out through the mouth, now we're going to do it one nostril at a time, as if you were blowing out your nose. And again, don't be bashful about this. The only requirements for breath of fire is a box of tissue and a bottle of water, because you're going to start to move things through your sinuses and your nose that you didn't even think you could move. So once you've done that mouth trick technique, you're going to start to extinguish that flame through the nose, one nostril at a time. So hand on the belly, seal the right nostril, and similarly, let's turn to the other side. Again, don't be bashful. What I was doing over there was blowing out forcibly on the exhale, small volume of air. I wasn't blowing it all out. It's a brief, brisk exhale. And after the exhale, I gave myself enough time for my lungs to reinflate, for that balloon to reinflate to a full inhale before I started to exhale again. And that is the key. If you don't give yourself enough time for the passive inhale, or maybe a little bit of active inhale, within 5 or 6 or 7 breaths of doing the breath of fire, you are exhausted because you've gone all the way down to a very low lung volume and you can't breathe out anymore. So the key is less is more with that brief exhale. Allow the lungs to reinflate before you start the brief exhale again. The belly leads the way. So now you are developing a muscle memory, if you will, of an active abdominal in, the pump moving in, the chest is quiet, the air moving out either through the mouth or the nose, and then the inhale reinflates you, the exhale starts again, you get into a rhythm. Kapalbhati is generally done with both nostrils, but it's tough to do that right from the get-go. Hence, these training tools, these little crutches to get you to walk first before you run. So Kapalbhati, when you actually master the technique, it looks like this. I'm not straining. There's no effort on my face. There's no effort in my chest. I'm not wheezing. It's just a pump at the belly, a nostril exhale that is brief, small in volume, enough time for the passive re-inhale before you start the exhale. It can be extremely invigorating once you're done with the practice. In fact, Kapalabhati stands for Kapala, skull, Bhati, to shine. So it's almost as if you're giving a massage to the skull. The energetics of this practice, you feel light, you feel liberated, you feel clear, you feel energized with vital energy. So if you're ready to do it, let's start it with music. All right, so sit tall, bring the awareness within. Keep one hand on the belly. We're going to start by extinguishing that candle first for a few breaths. And then we'll do it one nostril at a time. And then we'll liberate to both nostrils. Imagine that candle. Less is more. Brief volume. Now let's move to the nose. Bring the hand up to the right nose and exhaling through the left. Less is more. Feel the belly pump. Now switching to the other side. Left nostril closed. Get into that rhythm. Few more breaths, and we'll do it through both nostrils. Inhale fully before you exhale. Small volume. Now bring both hands down, both nostrils out. Close the eyes. Less is more. No strain on the face. Chest is quiet. Belly leads the way. Feel it. And release from the practice. Come back into watching the breath rather than making it happen, letting it happen. And as you feel ready, just open the eyes. So that was the breath of fire, Priya. It's a very invigorating practice. The belly leads the way. The nostril is where the air is expelled. And suddenly you find this value energetically and physically of a cleansing of your nasal airway, a patency in the sinuses, all the way like a massage that's you've given yourself on your scalp. You feel light, you feel clear, you feel vibrant.
It's an incredible experience. I've never had a breathwork experience like this where you're harmonized with music and you almost feel like you're co-creating this experience of building energy. And I also have a question for you about what this does for you somatically, because I felt like this release in the body. And, in medicine, we experience a lot of ups and downs with our patients. We hold on to a lot of micro traumas. And it almost seems like this is such a valuable practice in releasing some of that from the body. If you don't mind commenting.
Yeah, so in pranayam, this is actually a prep practice. Some schools don't even think of this as pranayam. This is always done before you start your routine. Now, you will note that, compared with the classes we've done before, this is a fast practice. So the energetics are going to be a little more accelerated. You're moving towards the sympathetic side of the axis in terms of the autonomic cascade. Your blood pressure is going to rise a little bit. Your heart rate's going to get sped up a little bit. You are always in control. This is not hyperventilation. This is brisk ventilation. You are always in control. So as you start to speed it up, as the CO2 is expelled a little more, you almost become hyperoxygenated. There are a couple of principles in medicine that we've both learned, the Haldane and the Bohr effect, that actually help cellular uptake of oxygen. You get a charge in your system with this practice. But it's not about really the charge, it's about what follows the charge. So it's building that cadence up, using the breath to let go of what was, what is, And then after the practice is over, there's a sense of calm. There's a sense of ease. There's a sense of peace. And people who've actually looked at EEGs after Kapalbhati breathing, you actually activate the default network where gamma activity is actually pretty high. So you move from sympathetic to parasympathetic after. So it's a way of physically releasing, CO2, charging the system only to allow it to rest. Okay, but you're always in control. This is not hyperventilation. We're not taking breathing to the extreme. We're taking it to the edge.
I think that's a beautiful explanation. And I think for a lot of our medical audience, this is something that we can understand in terms of physiology. And I actually wasn't even aware that there were EEG studies looking at pre and post breath breathing. And so I really hope that this becomes normalized in our medical world because it's a practice that everybody can do. And I think you mentioned that it's actually safe for most patients, other than in very specific contexts. For my patients specifically in the heart space, a lot of my patients suffer from coronary artery disease, cardiomyopathy, a number of different clinical conditions. Is this practice safe for those patients?
Yes, it's completely safe, except if you're having accelerated hypertension, poorly controlled hypertension, or if you're in a rhythm that is poorly controlled. So the flutters and the fibrillations of the world. If you're not well controlled, you don't want to do this until you've established control. And then once you've established control, then these practices can actually help, sort of restore the calm after a little bit of a storm. The research on Kapalbhati is still evolving. So even though it's a breathwork practice, it's a physical practice. I mean, you're moving the belly in. That diaphragm moves up. So there are changes in blood volume that are accompanied by the belly pump diaphragm moving up in terms of the right and the left sides of the heart. And if you time your practice with your pulse, it could also be valuable in terms of augmenting cardiac output or impeding cardiac output. So that research, I think, will evolve in time. We have a few electrophysiologists in town, and now I've met you, but we're hoping to do some studies just to see how we can pace breath to the inherent heart rhythm, to synchronize it, to augment it, and to help it settle in conjunction with medical therapy.
I think it's a really exciting space, and there are a lot of patients that could really benefit from it. I mean, patients that experience dysautonomia, and like you mentioned, once an arrhythmia is well controlled, how do we use this as a tool to prevent them from having that dysregulation in the future? People with POTS, these are all conditions where we have a framework within which we work, but I think that there's a lot of room for growth in those areas. And so it's incredible to see that this is something we can do very easily. I do have a question on a practical note. When should we be doing this ideally? Can I do this coming out of the cath lab, or should I be doing this first thing in the morning or right before I go to bed? When do you recommend that we do this?
So this practice can be done in the morning, especially once you've woken up from sleep. Most of us lose a lot of water. You want to fill up first in the morning, and then if you've been snoring, having any issues with breathing at night, this is a good way to start your day. Even before you shower, you're going to start to move so much stuff that you didn't think that you even had in your sinuses. So it's a good cleanse of the sinuses. And certainly at night, even before you go to bed, you can do about 2 or 3 minutes of this. If you're in a habit of rinsing your sinuses before you go to bed, this will actually open them up, open the nasal airway before you put your CPAP mask on or you tape your mouth shut. These strategies can be of value for those of us that have issues with breathing at night as it relates to sleep quality.
I think that's very helpful. And my dream is to have my whole cath lab outside the cath lab before first case start doing this together, because I know it's going to affect all of us in a very positive way. And the impact on sleep is absolutely incredible. Whenever we do this practice, should this be done with any other conditions? You said to go ahead and fill up with some water. Should this be done fasting or after eating, or what's the right way to do this?
So all of breath work is best done on a light stomach. If the stomach is full, it's going to have troubles with the diaphragm moving. You're not going to feel the full vigor of the practice. You certainly want to have water at hand because some of these practices can be drying. but always on a light stomach. In fact, of all the guidelines out there in terms of breath work, the one that I always sort of emphasize the most is light stomach. So in the morning, before you've had your breakfast, in the evening, before a burst of exercise or before supper, and if you're going to do something in the midday, then certainly before lunch, whether you're doing a nostril practice just to settle your stress levels with breathing. But always on a light stomach. That's the number one sort of emphasis that I'd like to really relate to the audience today.
I love that. These are like practical pearls on how to do breath work to maximize the benefits in your life. You did mention nasal patency, and I would love it if you could comment on that. I think we hear a lot about why being able to breathe from the nose and nasal patency is important. From your perspective as a pulmonologist, with all of this experience in the sleep space, what would you say are the most important things for people to know?
Yeah, so I mean, the nose, in terms of breathing, it's a lost art for most of us as human beings. We're always mouth breathing. Mouth breathing affects dentition, affects mid-face development. It certainly impacts snoring and sleep apnea at night, affects quality of life, it affects mood. The nose serves as a resistor, so it slows the breath down. It serves as a filter because of the hair, so it cleans the breath up. It serves as a humidification system because of the blood supply, so it warms the breath. So there are many aspects to just becoming a better nasal breather, and it also slows the breath down in terms of volume of air that you take. So there are breathing control reflexes that are activated. Most of us live on this junction point between clarity and congestion. And in a given individual, there are so many things that can affect either or. It's not just the anatomy. I mean, light can affect it, food can affect it, dental health can affect it, um, sexual activity can affect it. There's so many things that affect that junction point between clarity and congestion. And if you become a better nostril breather, nose over mouth, you're going to have benefits not only in the waking state, but also in the sleeping state. It turns out also that in pranayam, of the 4 receptors for prana in the body, one of them sits right here at the roof of the nose, right here. And if you navigate air into that corridor all the way at the roof, you're going to charge your system. Think about it. I mean, when people have fallen flat on their face, they're out like a light, you give them a smelling salt, right? It suddenly stimulates them into waking up. So this area in pranayam can be very valuable in terms of how you charge vital energy in the system and the channels of energy. In fact, this is a practice, this is just anecdotal, N of 1, which I did all throughout the pandemic when I was in the ICU. Taking care of, folks in the ICU where COVID was all over the air. And I know I had it. I know I clinically felt like I had COVID. I never tested positive. And I attribute my testing or negative testing to this practice of Kapalbhati. It kept me sanct, it kept me patent, it kept me safe, and it also kept me at peace.
I'm super grateful that you're willing to share your experience. And I really think it's important to normalize some of these practices, ancient wisdom that we have now proven with science. And I think it's incredible that someone like you has taken the interest and initiative to kind of develop these techniques in the Breathonance series. And I know you have a website that kind of goes into more of these lessons. And so you've made it very accessible for people, which I think is incredible work. We do have an audience question that's kind of interesting. So the question is this a practice that can be used in stress testing or any kind of diagnostic modalities? And do you foresee that becoming something that we integrate into our future testing of certain conditions?
So not as yet. I know he's also said that the GE case machine has a hyperventilation stage in the pre-procedure phase. This is not hyperventilation. This is brisk ventilation. If I had to sample your blood gases, yes, your CO2 would go down, your pH would rise a little bit, but we're not getting to the point where we're losing control. So does it apply to sort of the stress test machinery? Not as yet. I think those protocols will need to be built. And obviously, this is not an intuitive practice either. Ventilation, hyperventilation, bellows breath, or the Bhastrika sequence, what Wim Hof teaches, that's hyperventilation. That's uncontrolled breathing. This has nuance to it. This has, it's not something that can be learned very quickly for most, but it has to be taught. And how this gets into protocols with respect to testing, I think that work still has to be done in terms of the safety.
And you mentioned that it's really important to be properly trained in these techniques. And so I'm really hopeful that this will trickle into how we do education in the medical world, because I think these are very valuable practices when done properly, can be very impactful for patients and for us. I know we're running a little bit late on time, but we have one more question. Would this help COPD with the hypoxic drives depression? And when do these therapies help? And what are the indications and contraindications for this patient population?
So this is a population that's very near and dear to my heart. I deal with a lot of lung disease also in the clinic. For those who have bullous emphysema, so you have a lot of cystic disease with COPD, that's the one time where I probably wouldn't teach this. Those folks who are on supplemental oxygen, they're very hyperinflated, because you run the risk of creating big changes within those cysts. There is one case report of a pneumothorax in someone who did breath of fire breathing. This is from a few years ago, but when I looked at it, I wasn't convinced that really that was the reason. And again, when you're taught correctly, and we've done this in the lab, it can be done very safely, even with people with advanced COPD. But with bullous COPD, that's the one place I wouldn't do it. With folks who have reactive airways disease, chronic bronchitis, allergic disease of the sinuses, there is no downside to doing this for a 2 or 3 minute, twice a day duration. Completely fine. There are going to be perturbations with respect to O2, CO2, pH, but all within control. You're not. If you get dizzy, that means you are not in control. You've started to hyperventilate. You can do this at 60 breaths per minute. What we were doing was 40 breaths per minute with the music. You can do it at 60 or even 120 breaths per minute and just bob on the surface with respect to O2, CO2, pH. It'll be completely safe, but you have to do it correctly, right? So uncontrolled, untrained hyperventilation, this is not that. So other than bullous emphysema, yes, it applies, and it can be done safely by all other folks who have obstructive lung disease.
Perfect. That's very helpful to hear. And I feel like I could talk to you guys forever. Just the breathwork itself, the technique, the music, the energetics of the body, clinical intuition, the physiology. I mean, there's so many things. And so I'm so excited that we're going to be back in June with the next episode, and we're going to continue picking your minds about all of these topics. And Clint, thank you for this harmonizing musical experience. I've never experienced something like that before.
Well, it's a lot of fun. And thank you, Dr. Amit, as well. One thing I'd say, just reminding us about Women's Health Day, the music that we listen to in our mother's womb stays with us forever. And so that is the music we're trying to create to remind you that your mom's with you all the time. So that's my message.
Oh, guys, this was such a cool experience, and I cannot wait until June. Thanks again for doing this with us.